name is Linda Lee, Linda J, middle initial Lee, and I've been coming to Dr. Attatro since this summer, and actually in August, I think, was my first time meeting him. And he was referred by my family dentist to correct a horrible fracture where my tooth broke off, and it was irreplaceable, or whatever, sorry. But anyway, so he looked at it, and he said, well, there was two routes, either bridge or possibly an implant. I am, for many, many years, been a diabetic, and I had some struggles with controlling blood sugars, and I have heart issues and just all kinds of other health problems. And so he was awesome. That's all I can say, is he was awesome. And the atmosphere, I mean, every one of those that worked with him, alongside him, were just as professional and just as compassionate and caring as I have ever known. We have lived in other countries. We lived in Japan for 26 and a half years, and he considered everything. He got to know me as well as not just a patient, but he learned things and kind of could, I guess, determine what was the best route to go in preparing my replacement with an implant, and considering all the things that I had going on with my heart and being on blood thinners and things like that. I was just blown away by the tenderness with how just everyone involved along the process of getting my new awesome implant done. And because of the professional way that they dealt with it, knowing I would have blood pressure problems, on all kinds of medications, I've just never ever had that kind of experience before. I would highly recommend their practice for anyone. I mean, for many years, and in Japan, they treat the symptom. They don't even consider preventive care. It's just treating the symptom, pretty much by and large, over the many years I was there and having my teeth repaired. I am so very thankful for this practice and for Dr. Attatro, and Dr. Cahill was the one that referred me to him, and she knew him personally and was very impressed with his skills, his professionalism. She loves him to death, and I too can say that now as well. And everybody that works with him too, I could say, highly recommending this practice. Yeah.
Thank you so much.
Yeah.